Killed by medicine. How to avoid the number one cause of death. I hope you like this. I gave this as a keynote presentation last week to a group of people that really enjoyed this. It really brought the house down. And when I gave the presentation, I asked the audience members if they had any guesses as to what the number one cause of death was. And the most common answers were gun violence, diabetes, cancer, and heart disease. And this is important to note what our conceptions are versus what the reality is, and then to wonder, why do we have these conceptions? Where do they come from? And I'll dip into that subject a little bit further along in the video, as this can reveal some of the hidden aspects of our unconscious mind and how we can be manipulated unconsciously. But I won't keep you guessing any longer here. The number one leading cause of death in the U.S. is medical care. And don't let the smiles fool you. And of course, some of you may be doubting this claim, but you might be aware, if you're someone who pays attention to these topics, that the mainstream medical system and the mainstream media has acknowledged that medical care is the third leading cause of death in the United States. A few years back, CNBC reported that medical care was the third leading cause of death in the United States. And this was based on a Johns Hopkins study, which claims that more than 250,000 people in the U.S. die every year from medical errors. And of course, Johns Hopkins is the preeminent medical research university in the United States. And it's important to note here that medical errors are just part of the problem here, as a medical error is defined as the failure of a planned action to be completed as intended, meaning an error of execution or the use of a wrong plan to achieve an aim, such as an error of planning. But there are many other ways to die from medical care besides medical error. So it turns out that Johns Hopkins was wrong in their estimate. And according to the research done by Gary Null, PhD, Carolyn Dean, MD, Martin Feldman, MD, Deborah Rossio, MD, and Dorothy Smith, PhD, the total number of iatrogenic deaths, which is death by medical care, is 783,936. So now back to people's guesses from the other night when I gave this presentation. In 2023, there were 46,728 gun-related deaths in the United States. Diabetes is a leading cause of death in the U.S., with approximately 95,000 to 100,000 deaths annually, where it's listed as the underlying cause. And recent data indicates that when including cases where diabetes was a contributing factor, the total is significantly higher, often exceeding 399,000 deaths per year. That is still dwarfed by the annual cancer death rate, which is 553,251, which is still less than the heart disease annual death rate, which is 699,697. But of course, all of those are topped by medical care. So it is evident that the American medical system is the leading cause of death and injury in the United States. And this kind of gives me the shivers when I see this advertisement around town for UCLA Health. And 783,936 is a conservative number. The true number, when extrapolated, is well over 1 million people per year. And in a survey conducted by the National Patient Safety Foundation, it was found that more than 100 million Americans have been impacted directly and indirectly by a medical mistake. And as one of the authors of this paper put it, when the number one killer in a society is the healthcare system, that system must take responsibility for its shortcomings. It's a failed system in need of immediate attention. So working with the most conservative figures from these statistics, they projected a 10-year death rate of nearly 8 million people. This estimated 10-year total of 7.9 million iatrogenic deaths is more than all of the casualties from all the wars fought by the U.S. throughout its entire history. This is the equivalent of 6 jumbo jets falling out of the sky each day. And again, this is a conservative number, as statistics show that as little as 5% of medical errors are actually reported. What's even more incredible is that these figures show that an estimated 164 million people, more than half of the total U.S. population, receive unneeded medical treatment over the course of a decade. And I won't go into the data in this video on how chemotherapy and radiation actually cause cancer and how a good portion of the deaths attributed to cancer should be attributed to medical care. Not to mention the deaths from some other medical procedures that have been attributed to an alleged infectious disease. I'm not sure if they're going to delete my account if I say too much here, but I think everyone knows what I'm talking about here at this point, as even the mainstream channels, government agencies, and pseudo-truth influencers are now talking about this openly. And you have to wonder where all these people were in 2020. So how can this be? It's hard to imagine how we've come to find ourselves in a situation where we can't trust the mainstream medical system. But when you start to peel back the layers of corruption, you start to get the picture of how we found ourselves in this situation. And this article here explains how 2.7 million people each year who have been correctly prescribed medication experience a serious adverse reaction, and how at least 128,000 people die each year from this, which matches stroke as the 4th leading cause of death in the United States. Simply entering a hospital could result in the following: a 2.1% chance of serious adverse drug reaction, which affects 344,000 people, a 5 to 6% chance of acquiring an infection, which affects 902,000 people, between a 4 to 36% chance of having an iatrogenic injury, which is medical error or adverse drug reaction, which affects between 656,000 and 5.9 million people. And you have a 17% chance of procedure error, which affects 2.8 million people each year. Women fall victim to this more than men, including thousands of prophylactic mastectomies are performed annually. 1/3 of U.S. women have had a hysterectomy before menopause. Women are prescribed drugs more frequently than men. Women are given potent drugs for disease prevention, which results in disease substitution due to side effects. Fetal monitoring, which is unsupported by studies and not recommended by the CDC, confines women to a hospital bed and may result in a higher incidence of cesarean section. Normal processes such as menopause and childbirth have been heavily medicalized, and synthetic hormone replacement therapy, HRT, which does not prevent heart disease or dementia, does increase the risk of breast cancer, heart disease, stroke, and gallbladder attack. And as many as 1/3 of postmenopausal women use HRT. And this number is important in light of the much publicized Women's Health Initiative study, which was halted before its completion because of a higher death rate in the synthetic estrogen progestin HRT group. Unnecessary surgeries claim many lives. In 1974, 2.4 million unnecessary surgeries were performed, resulting in 11,900 deaths. In 2001, 7.5 million unnecessary surgical procedures were performed, resulting in 37,136 deaths. And in the same way that prescription drug use is driven by television advertising, unnecessary surgeries are escalating as well. Media and celebrity-driven surgeries such as gastric bypass for obesity, which is modeled by Hollywood celebrities, seduces obese people into thinking this route is safe and sexy and easy and permanent when nothing could be further from the truth. And of course, we've heard many gruesome tales about surgical instruments and sponges being left inside people after surgery. And unfortunately, these aren't isolated incidents. The Federal Agency for Healthcare Research and Quality found that this mistake occurs 2,700 times a year in the United States. And as Gary Null puts it here, the cumulative daily effects of steaks and colas and pizzas and pollution and computers and cell phones and pesticides places us in a toxic soup environment. And instead of cleaning this up, many turn to medication for help. And drug companies are paying our legislators, television and radio stations, schools, and news outlets to keep this information from you. You are Big Pharma's client. Big Pharma wants your account, and they pay the quackbusters to attack anyone who tells you the truth about what is really making you sick enough to seek expensive, quote-unquote, care from the number one source of fatalities in America. Care that might readily kill you and your loved ones. Death by medicine. And if we are still plugged in to the mainstream society on any level through the healthcare system, the mainstream news, TV programming, and the mainstream school system, we tend to develop this cognitive dissonance because what is portrayed in the mainstream is that this is somehow normal. Like it's normal to die from medical care. I mean, come on, even Michael Jackson did it. And it's the same psychological mechanism that death cult leaders like Jim Jones used to persuade his followers to drink his poison Kool-Aid, which resulted in their deaths. And that psychological divisions of the military, guided by think tanks such as the Rand Corporation, used so effectively during the COVID operation and its many aspects to encourage people to protect themselves from an alleged deadly disease. And at the end, I'll share a truly frightening story that one of the audience members shared with us the other night that really demonstrates this cognitive dissonance and why it's so dangerous. And this isn't just a bunch of random conspiracy theory. Even former insiders are coming out about this dilemma. This is Dr. Marcia Angel, who was the former executive editor of the New England Journal of Medicine, which is arguably the most prestigious medical journal in the world. And she is saying that it is no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. And yet we still line up desperate to get some of this so-called medical care. And the question then becomes why? And this can be a very deep subject with many aspects to it, but I'll outline a few of them here. And I'm going to shift gears and talk a little bit about the mind. And in a basic sense, we can talk about the conscious mind and the unconscious mind. And in general, the conscious mind refers to the thoughts, perceptions, and sensations that are currently in our awareness, while the unconscious mind encompasses all mental processes that are not currently conscious. And some estimates suggest that the conscious mind represents only about 5 to 10% of the total mental activity, with the remaining 90 to 95% being unconscious. Our subconscious mind drinks in the culture and the schooling and the media programming and the advertising and responds to it. The question you want to ask yourself is who or what is doing the programming. As Dr. Joe Dispenza explains, 95% of who we are by the time we're 35 years old is a memorized set of behaviors, emotional reactions, unconscious habits, hardwired attitudes, beliefs, and perceptions that function like a computer program. So a good portion of what I do is help people to deprogram their minds from the conditioning that we have received from our schooling and from our entertainment, where we are taught to believe that modern Western medicine is the apex of health and healing and civilization, when in fact it is the exact opposite of that. Our subconscious mind is being programmed by huge corporations with limitless advertising budgets to eat fast food, to drink poison drinks, and take drugs. One relevant example of this is in the US, 70% of the advertising in network news programming in non-election years is from pharmaceutical companies. And in the US, 70% of the people are taking at least one prescription drug. And it would be a mistake to think that any of us are not susceptible to this kind of mind manipulation. These advertisers know what they're doing. Here's what Edward Bernays had to say about it. Bernays is known as the father of modern public relations, or what used to be called propaganda. And Bernays was the nephew of Sigmund Freud, and Bernays used many of the psychological motivators that Freud uncovered to push the products that have poisoned and maimed us over the last century. So just watch the advertisements for any of the antidepressant drugs being currently advertised. For example, people seeking a more joyful existence and relief from worry, stress, and anxiety are frequently swayed by the messages endlessly displayed on TV and billboards. And often, instead of getting relief, they fall victim to the myriad of iatrogenic side effects of antidepressant medication. And just note that when they tell you the side effects during these commercials, they often show a pastoral scene of beauty or a joyful activity at the same time. So you will equate the obligatory warning of danger with a pleasant memory. And we know that the General Accounting Office, an agency of the U.S. government, found that of the 198 drugs approved by the FDA between 1976 and 1985, 102, which is 51%, had serious post-approval risks. The serious post-approval risks included heart failure, heart attack, anaphylaxis, respiratory depression and arrest, seizures, kidney and liver failure, severe blood disorders, birth defects, fetal toxicity, and blindness. And there are many examples of the dangers of these drugs and the outright criminality of the pharmaceutical companies that manufacture and market these drugs. One of the most blatant examples was the prescription pain reliever Vioxx. The Los Angeles Times reported that witnesses told the Senate panel that Merck and Company and the Food and Drug Administration knew before the agency approved the company's Vioxx painkiller in 1999 that the drug could have serious adverse effects on the heart. But the FDA gave its approval without resolving the concerns, and Vioxx was aggressively marketed to point out its pain relief qualities and not its risks. And over 100,000 Americans have paid dearly with their lives for this failure. And not only did the FDA ignore known risks from Vioxx and related drugs, but it tried to prevent researchers from publicizing their own research that proved the extent of these risks. And it's not just Vioxx. NSAIDs, which stands for non-steroidal anti-inflammatory drugs, rank first among commonly prescribed drugs for serious adverse reactions. And as it has been estimated conservatively that 16,500 NSAID-related deaths occur among patients with rheumatoid arthritis or osteoarthritis every year in the United States. And this figure is similar to the number of deaths from AIDS and considerably greater than the number of deaths from multiple myeloma, asthma, cervical cancer, or Hodgkin's disease. In 10 years' time, NSAIDs killed 2.5 times as many people as were killed in the 10 years of the Vietnam War. The British Medical Journal warned that women who took painkillers like Advil, Motrin, and Naproxen had an 80% higher risk of miscarriage than the women who avoided these medications. And more recently, of course, we have the number one doctor recommended pain relief brand being linked to autism, liver failure, and death. Now, I realize some people might think that these adverse reactions are worth the risk until they realize that not only are these drugs dangerous, but also they don't work. In 2003, Dr. Ellen Roses, a senior executive at GlaxoSmithKline, Britain's biggest drug company, admitted that most prescription medicines do not work on most people who take them. 90% of these drugs only work for about 30 to 50% of the people that take them. And that really just makes most drugs less effective than a placebo. And so the way to avoid the leading cause of death in the United States, Nancy Reagan said it best, is to just say no to drugs and medical care. And so, of course, we all have health issues that come up with ourselves and with our families, and you may find yourself in a position where you don't know how to take care of yourself or your loved ones. And that, of course, can be a dangerous place to be, because as we've seen here, healthcare does not equal health. And not knowing how to take care of yourself and your family's health keeps you trapped in the medical matrix. But there is a way out, and I've been able to successfully navigate the way out of it for myself and my family and my clients through natural healing. And I mean completely out of that matrix where I canceled my medical insurance and turned my back on the big pharma medical matrix many, many years ago, literally saving hundreds of thousands of dollars on worthless health insurance, not to mention the time and grief and heartache. And I've had quite a few clients do the same by educating themselves how to properly take care of themselves and achieve true health freedom and sovereignty over their lives. If you want to know more about how I was able to exit the medical matrix, there will be a link below that will take you to a recent masterclass I gave that outlines the process we use to help people unwind their disease. If this is something you want to learn about, just click the link below. And now I just wanted to share the frightening story I mentioned at the beginning of the video that one of the audience members bravely shared with us about his personal brush with death by medicine. And this person shared with us that he was having some pain in his kidney, and he obviously didn't know what to do about it. So he went to the doctor, and the doctor prescribed him some painkillers, which almost killed him due to an adverse reaction, as he had been taking some other medication which didn't mix well with the painkillers and was counterindicated. But the truly frightening part of this story was the cognitive dissonance that this person still has with the medical system. And he continued to rely on medications and doctors even after they had nearly killed him. And he normalized the experience and advised people, as he told the story, to keep an eye on their doctors because sometimes they make mistakes. And to me, that was just a perfect demonstration of the power of the medical matrix. I hope you enjoyed this video.